Okay, so for those of you that don't know who I am, my name is Kyle Jenkins. I'm the Programs Administrator at Eastern Carolina Homelessness Organization, and I deal heavily with our Homeless Management Information System, otherwise known as HMIS. We also have Stephen Stark and Gilbert Floyd here, both of our fairly new recruits with HMIS. They're our system administrators. And they're here to be able to help field any questions as we get them in. And we hope that we can get through this quickly for you all, and then we'll email you out the recording to send it to any other HMIS users that you may have in your organization that we're not able to get on. So thank you, everybody, for those that were able to get on, and we're going to go ahead and get started. I wish that beeping we could get that thing to stop. I turned it off in the settings, but for some reason it's not stopping, so I apologize for the beeping in the background. We're new to this Join Me app, so bear with us as we are trying to learn and perfect the system. So the HUD data standards happen around this time, almost on a yearly cycle now. I've been working for ECHO for a little over 2 years, and every single year they've either had a major or a minor update for HMIS, and they call these updates the data standard changes. And all that really means is that HUD and their federal partners like the VA and HHS and the other programs that have joined in with us on this database have decided to add new things that they want us to collect in the database, or make small modifications to the way that we're collecting certain pieces of information in the system. So all this is going to be is a general overview of all of those. The way that we're going to do this is we're going to do overall changes for everybody in the system. We're going to go over PATH briefly, HUD, VASH, and SSVF, which is the VA-funded programs. And then runaway homeless youth will be the last one that we go over with HHS. So the changes that have been done this year, they all started October 1st of this year. So today's the 3rd, but today's the first working day that we've had since the new data standard. So we wanted to get this done first thing in the morning so everybody could be well aware of what's going on. In the HMIS database system, all of the assessments for pretty much everybody that has RHY, SSVF, HUD, VASH, PATH, a COC grant, an ESG grant, and also most of the shelters on HMIS have been updated to these new data standards. So when you go in this morning after this webinar, you will be able to see the new changes that have been made on the assessments. We've also reordered a few of the assessments and added in a couple of explanations to some of the questions to be able to help guide with data entry as well. If you have a problem and you get onto your provider's entry, interim, or exit assessments and you do not see any of the changes that we talked about here, or you just want to make sure, you're more than welcome to put in a ticket at echomeless.org. On the top menu item, there will be HMIS/CES. Once you click on that, the first option will be send a support ticket, and that's the easiest way to get in touch with any of us that deal with HMIS over here at ECHO. Okay, so quickly, the universal data element changes. These are all the critical changes, kind of in a broad overview. As you can see, there's a gender wording change. There is now going to be, we're going to collect disabling condition for all clients now. That's including children. And when they say that, all they're talking about is the disabling condition yes, no. They are not asking us to collect the different types of disabilities for all clients. Some programs do, but as far as anybody that uses the system, you know, your general users, they're just asking for us to collect if they have a disabling condition or not what those disabilities are. And then there's a big change to the way that they're doing living situation. For those of you that have been using HMIS for a while, that's the residence prior to project entry, and then the length of stay in that situation. So there's been a big change for that. We'll make sure that we go over that in detail. And then there's program-specific data elements, and these are the changes to the specific grant programs. The gender wording change. So what they did with this is they took out the other category. So there is no longer actually going to be this if other specify. What they're doing instead is they are adding in a doesn't identify as male, female, or transgender option. Everything else is staying the same. They're just adding in doesn't identify as male, female, or transgender. And it says record the self-reported gender of each client. So it's just self-reported. We don't really need to dig deep into this. HUD has made it very, very clear that we need to be sensitive to the people and the persons that we're asking these questions. So we just ask the question, or if it's on a form, just let them identify as whatever it is. We don't need to verify it with anything. This is a self-reported data element. Disabling condition. So the data collection instructions are to record whether the client has a disabling condition based on one of the more of the following. So they want to make sure that it's either a physical, mental, emotional impairment, including impairment caused by alcohol, drug abuse, or post-traumatic stress disorder, or a brain injury. And the three things that they really look for HUD to define it as a disability in HUD terms is expected to be of long, continued, or indefinite duration, substantially impedes the individual's ability to live independently, and could be improved by the provision of more suitable housing conditions. So like I was saying, they are opening this question up to everybody in the system. So whether you have a federal grant, a state grant, or you don't have any grants at all, they are asking that everybody collect the disabling condition, yes or no. They are not requiring the individual sources. Like they are not going to ask if you don't have a HUD grant, they're not going to ask if you have HIV or substance abuse or alcohol abuse or a mental health disorder or anything like that. They just want to know yes or no. And then here's the big one. This is the living situation. They made some big changes with this. They've been revamped, and I really like the way that they did this. They have created this to what they call conditional formatting. And what that simply means is that if you select one option, a question appears. If you select another option, different questions may appear. So so if you choose emergency shelter or a place not meant for human habitation, a certain series of questions will appear for you on your assessment. If you choose transitional housing, another series of questions will appear, which makes it really nice so we don't have to know which questions need to be answered for which program. And it really just makes it nice so that way you as the user don't have to remember which data elements are required for your program and which are not. So this is done at project entry. That's not changing. So when they first enter the program, we want to be collecting this information. And we want to know if the person is coming from the street, place not meant for human habitation, emergency shelter, safe haven, which I don't think we have any of those. That's actually a HUD-funded program, and we don't have any in our continuum. They want to know if they're coming from transitional, or any other type of institutional setting. I'm going to kind of quickly skip over that because I'm going to show you guys in Bowman and HMIS what that looks like. But what this does is the element adds a new response option, which is interim housing. And interim housing is not a type of housing, but it's rather a situation where chronically homeless people have applied for permanent housing. They've been accepted, but they're waiting for the unit to become available. They're just not immediately able to move right into the housing. Let's just say it's getting repainted or the tenant hasn't moved out from before, anything like that. And if it's deemed that it's absolutely necessary to keep that client engaged and moving towards the housing, we can put them in a temporary solution. And transitional housing can be used for the client to be able to move into to wait for the housing unit to become available. So someone can come in, get accepted to the program. We're just waiting on a unit. We can allow them to stay in a shelter or a transitional housing unit, or some type of temporary situation until that unit becomes available. As long as it's less than 7 days, that's perfectly acceptable. And that will be used as what they call interim housing. It's going to be a new drop-down box that we're going to have. And so that allows them to get off the street and stay engaged so we don't lose that person while we're waiting on the unit to be able to come available. So these are just, this looks like a kind of a scary table, but this is just the different types of the field that will be in Bowman's HMIS, and then the different options on the drop-down list. So the first thing we're going to find out is the type of residence. So we're going to find the residence prior to project entry. You're going to either select an institutional setting, a transitional setting, or a homeless situation. Oops. How do I go back? Sorry. Okay, so depending on what you select, if it's a homeless situation, then it's going to ask you the approximate date that it started, the total number of times homeless on the street, emergency shelter, safe haven in the past 3 years, and the total number of months homeless on the street, emergency shelter, safe haven in the past 3 years. These 3 questions are not anything new. These are the same questions that we've been asking or doing for the past year. The difference is now they will only populate for certain answers to the residents prior to project entry. If you select a transitional housing option, it's going to ask you if they were homeless before they went in there. Institutional setting, same thing. It's going to ask you if they stayed there for less than 90 days, and it's going to ask you if they were homeless before they went into that institutional setting. So there's a lot of, if you answer this question this way, then you'll have to answer these other questions. We haven't quite figured out how to do that in a paper format. HUD is really pushing people to do live data entry. I do know that there are lots of concerns or issues that arise when you're trying to do live data entry, especially when you find yourself out in the field trying to collect this information. So we are working on trying to get a paper form together that makes sense and that's easily accessible and easy to use. But until then, we'll just have to figure out how we're going to do this. We're going to try to have that by the end of the week to everybody. Okay, so for health insurance, there's just a new option that's been added. Indian Health Services Program is a new option. And then they're just going to have an other field for like local type of health insurances. So that's the 2 new options for the health insurance sources. Okay, so these are going to be programs specific to PATH. We're going to go through these pretty quickly. So there's just been a change in the PATH funded services option. So for the PATH folks, when you're adding a service, you guys have to answer a specific question for PATH funded services. On that drop-down box, they've just changed outreach, the outreach option, to re-engagement. And they've also added screening and assessment. So they split these up into 2 different responses. They also changed housing technical assistance to housing eligibility determination. And then they removed other PATH funded service. If you have any questions about what these terms mean, they do have a small definition of them in the data elements that if you want to know what they mean by that, you can email me and I'll send that out to you. So for the referrals provided by PATH, so this is the same thing just on the referral side. So when you go to send a referral, there's a drop-down box that you have to select for referrals for PATH. And they just changed a couple of the options. Primary health care has now changed to primary health/dental care. Relevant housing services changed to housing services. Housing placement assistance was changed to permanent housing, and temporary housing was added. And then medical assistance was changed to medical insurance. So they're just really trying to clarify these referrals and what the responses mean in the drop-down box. And I know that's a good thing because we were all questioning kind of what some of them meant. Okay. And then the residential move-in date, we put it in the past part of the slideshow, but it does apply to anybody that runs a rapid rehousing program. That would be ESG rapid rehousing, COC rapid rehousing, and any type of outreach program. So the residential move-in date used to be where it would ask if they were in permanent housing, yes or no, and then they would ask for the residential move-in date. There's lots of issues with that, with how that reports out and the data collection they were getting. So they revised this data element to just ask the date that they moved into the unit. For outreach and for rapid rehousing programs, that is the date they actually move into that house or that apartment. And the reason why they asked this question is because for reporting purposes with these system performance measures, if they're in your program still, but they're housed, we don't want to count them as homeless in point-in-time counts and housing inventory charts and things like that. So this allows us to be able to identify the people that are still in your homeless program but are no longer homeless. This will be only on the assessments for PATH, RHY outreach, HUD COC programs, and HUD ESG outreach programs, and rapid rehousing, excuse me. And this can be identified either at entry, interim, or exit. But most of the time, if they haven't moved into a place by exit, it's probably because you're exiting them because we weren't able to move them into a permanent housing situation. So most of the time, you're going to answer this question on the entry or the interim. Connection with SOAR. So connection with SOAR is going to be asked for the PATH program. They just want to know if the SOAR program is, if they're making connection from the PATH outreach workers, and that is for SSI and SSBI. And this is just a yes or no answer. Okay. So HUD VASH, and then we're going to do SSVF. We don't have any slides on SSVF, but we will briefly touch on it. With HUD VASH, they're just asking a couple of new questions. One of them is last grade completed. The other one is employment status. And the third one is general health status. So they're asking these questions for the HUD VASH as well as SSVF program. And it's also an RHY data element as well, so that's why it's on here. And so this is the responses for the last grade completed. You have less than grade 5 through 6. It goes all the way through up to college education. So you can see that there. Okay. Bear with me for just a moment here. Okay, sorry about that. So real quick, I just wanted to show you I hope everybody can see this. So this is the SSVF entry for rapid rehousing. I don't have any slides on this, so I figured it would be easier just to upload it. But everyone can kind of see what we're moving to with the assessments. We're going to have a clear definition of the different sections, and they're going to be labeled. And then there's little snippets to help you kind of with the data entry process. So this is that last grade completed option that we were just talking about for HUD VASH. It's also required for SSVF, and those are the options that you saw on the webinar screen. With SSVF, this is not for HUD VASH, but for SSVF, they also want to know the use of crisis services. So that's the number of visits to an emergency room in the past year, approximate number of nights in jail, prison in the past year, and the approximate number of nights spent in an inpatient medical facility in the past year. Here is the homeless chronic status head of households and adults. So this is the living situation that we went over briefly. And let's see if we can get this to work. See how those questions disappeared when I have nothing in here? So when I select a homeless situation, it asks me about the questions that we're used to for the chronic homeless situations. If I select an institutional setting, it's going to ask me it's going to have, did you stay there less than 90 days? And that's based off of the length of stay of previous place. And then it's going to ask if on the night before, did you stay on the streets, emergency shelter, or safe haven? If I put yes, it then adds the other emergency or the chronic homeless questions that we're used to seeing. And then transitional works kind of the same. If I put a transitional situation and then I tell it that how long the length of stay was. So did you stay less than 7 nights, yes or no? So if I put 90 days or more, it's going to say no. If I put 2 to 6 nights, it's going to have, did you stay in an emergency shelter, safe haven, or on the street before that? So it really helps with kind of getting the correct information for those different HUD homeless situations that can be a little daunting sometimes. Okay, and then there's that residential move-in date that we were just talking about. So that's the rapid rehousing assessment. The homeless prevention assessment has a lot of the same elements. A couple of them are removed. And then it also has an HP screening targeting criteria on here. So when I first pull it up, it's going to ask about the HP screening score and the grantee targeting threshold score. And then it's going to ask all these questions about the targeting criteria. And they follow similar to what the new HP screening tool is that started October 1st. So there's probably a reason why they pushed to have that done by October 1st as well. But there's those questions that they're now wanting us to answer at entry. And then, of course, the residents prior to project entry questions are not going to be asked because we know that they are in a place not, they're not in a homeless situation. Okay. So as far as the overall changes, that's really it. A lot of them was that big living situation change that we were going over. It's going to take a little while for probably everybody to get used to that. And this is not going to be the only training that we're doing on this. All of our trainings that we're going to be, that we do either on site or however we do it, we will include these new data elements. The way that that HUD wants this to be done for all programs is if somebody is in your program on October 1st, so that means somebody before October 1st was still in your program through the date of October 1st, or anybody that comes into the program on October 1st or after, all of them have to be updated with these new data elements. So permanent supportive housing, SSVF, all these programs, RHY, PATH, everybody should be going in over the next week or two and figuring out which clients were in their program as of October 1st and going ahead and trying to get this information updated in the system. We will also be sending out some reports this month here, probably by the end of the week, and they're going to be the data quality reports, and some of you get the 631 APR detail report as well. We will make sure that we send some type of report and point out to you in the email where you can see the entry for every person in your program, so that way, entry and the exit, so that way you can make the decision on if this person is somebody that needs the new data standards updated in their entry. If you have any questions, you can always give us a call, or you can send in that support ticket at our website. But we look forward to trying to get everybody on board with this and making sure that we get it updated as soon as possible, so that way we're all in compliance with these new changes. So I'm going to quickly turn off the mute, and if anybody wants to ask any questions, you're more than welcome to. Okay, so it's unmuted. Do you guys have any questions? I know we kind of went through them really fast and jumped around, so I just wanted to make sure everybody that was on kind of got the general idea. And like I said, most everybody's assessments in the system have been updated to these new assessments. So you're more than welcome to play around and then ask us questions later too if you don't have any at the moment.
Hey, Kyle, I have a question real quick.
Mm-hmm.
This is Natasha.
Hey, Natasha.
So you're saying, well, I didn't really catch the whole thing about, like, in our program. I know our program's one of the smaller ones. Mm-hmm. Would it be a good practice just to get everybody updated, or what would you prefer for us?
Yeah, for the permanent supportive housing, it's pretty cut and dry because they're longer-term programs. Pretty much anybody as of October 1st, if they were in your program, then you would want to go ahead and update them.
Okay.
So that probably, I would think that that's pretty much everybody that's on your current roster right now.
Okay. All right. I think that was the question that Nancy and I had. We were just trying to figure out. So we might as well just go ahead and do that.
Yes, ma'am. That's probably the biggest one for the permanent supportive housing, I think, is going to be that new living situation. And you may be able to answer that for the majority of your clients. Another thing that I failed to mention, I'm glad you brought up your program, is Angie from HUD had asked us as a continuum and actually brought it to the state as well for the HMIS committee. But she wanted to have us put the residence that the permanent supportive client is staying at. So we did go ahead and add that at the entry and the interim assessment, so that way it gives you the ability to put in the address of which unit that person is staying at. And she asked us to do that so that way when we come and monitor and they come and monitor, you could quickly see which unit each person is assigned to. And the assessment gives you the ability to put a start and end date, so if they move or anything like that, you can just update it as that person moves around or however the situation occurs. But that is one of the things that she had asked us to add to these assessments. So I did go ahead and throw them in there while we were making the changes. And I will make sure that we go into a little more detail with that, either in some type of step-by-step training video or future ongoing trainings that we do in person.
Okay. That makes sense. I mean, Nancy has a really good handle on where our folks are, so if it is just putting in an address or anything like that, we can definitely do that. So we're gonna have some fun playing around with all this stuff. So.
Call me or send a support ticket if you need help.
We'll do the support tickets. That's really been a help, and you guys are so great about responding. So thank you guys for that. We really appreciate it.
Well, thank you. Anybody else have any other additional questions?
Hey, Kyle, this is Michelle. Can you go back to that path table, I guess, that was up there where it actually said that they replaced outreach with the term re-engagement. Can you go through that? That's
for the services, correct? Can you see that?
Because I was on another path-related webinar where they didn't replace the word re-engagement with outreach. So I just want to make sure I follow that. There it is. Yeah.
Let's see, because I
That's what it says at the top there, isn't it? It says.
That's what it says, and then also on the table, it also doesn't show outreach on here anymore. It just shows re-engagement.
Engagement, right.
And when is what table actually is this though? Is that once someone's been enrolled, or is this?
That is the services table. So this is actually talking about when you create a service for the client in PATH.
Right. Which is always after enrollment, is that correct?
Let's see. It could be once per service provided at the time of first provision of service is the collection point. And then it just says that we record them solely for the head of household. But you would be using PATH-funded dollars.
Right.
So I would imagine that would be after they were enrolled in PATH. You wouldn't be spending PATH-funded dollars unless they're enrolled. Is that correct?
I mean, no, you could still be outreaching technically, I guess, but I just want to make sure I follow the changes.
See where it says 2014 version 5 updates. Response options were changed by PATH. Outreach has changed to re-engagement.
Right, right.
And that's directly from the HUD Data Standards Dictionary that they have online.
Okay, because when I asked for clarification on this on another webinar, it made it real clear that re-engagement was just when you had already enrolled somebody and had been working with someone formally, you know, as a active client, and then you hadn't seen them for a while and you needed to re-engage them. You know, you're not really starting over with outreach. You're just re-engaging them, you know, because that's a different kind of client, someone who's already enrolled. But this kind of sounds like, you know, you're really not outreaching anymore. You're just re-engaging. So that's interesting.
My understanding.
They took the this is Jackie. Good morning, everyone. They did take that category of outreach from that right there, and they do have re-engagement. They used to have outreach, so I don't know.
My understanding of re-engagement is exactly the way that you defined it, Michelle. I think what they've decided to do is to not track outreach as a service because every single person would be outreached. And I think they can collect that information from the contacts.
Yeah, I follow you. You're right. This is a type of service, right?
Right.
Okay,
right.
So you would not have a service of outreach after you're already outreaching them and you've already enrolled them. I follow it.
Exactly, and I think they're just doing that to clarify it better.
Yeah, no, that you actually defined it better than the other contractors did. Okay, good. Telling you, Kyle, you're up there.
I tell you what, he's a keeper, isn't he?
You understand this stuff better than
we're trying.
Okay.
Anybody else have any other questions? Thank you, everybody, for getting on. This is actually the biggest webinar we've had so far. So 14 people got on.
Wow, that's great. Good
Kyle,
job, though.
Kyle, this is Brenda.
Hey, Brenda.
Over here at New Directions. Grace and I are both here. The PATH questions and the HUD bash, they're not going to be required from our clients, or are they over in our shelter?
No, they will not be. The only ones that are going to be required for you guys is that living situation change with the conditional formatting.
Right, okay.
And that's already been updated in your assessment. You guys were already collecting all the other data elements that they've now made required, like the disability stuff. We were already collecting all that in your assessment, so you guys were already ahead of the game with that. So the only thing we had to do was update your living situation. So when you go in there for all of your programs, they should now have that conditional formatting where if you select one option, then other questions appear, and it should be working correctly. And if it's not, just send me a ticket or call me, and we'll make sure we get it fixed by the end of this week.
Okay, perfect. Okay, thank you for that clarification.
You're welcome.
Mm-hmm.
Kyle, do you foresee any changes with APRs for next year? Any of this, or is this,
there's a rumor, but you didn't hear it from me, that it may be completely changed.
Wow.
That the APR process may be completely different for next year. I just don't know if HUD's going to have time to pull what they want to do together.
Right.
But apparently there may be some major changes coming with the APRs for the 2015 funding year.
I was just curious with some of the, changes in the standards.
Yeah, now Bowman says they're going to update the APR reports to include these standards as of today. They sent out an email at like 9 o'clock at night on Friday saying that they're going to update that report today. And then the 631 report will be updated by the end of this week as well.
Well, if they're updating their report, doesn't that mean that HUD has to update theirs? Because we have to key it into the HUD APR and eSNAP.
That's correct. So when they first did the national webinar last Wednesday or Thursday, the HUD field rep for HMIS made a scary statement saying, we don't think, there's no more APRs that'll be due, FY14 grant years all ended October, or, the end of September is what she said. And of course, in our continuum, we have 2 grants that go on till after September.
Right.
And so we all sent in a bunch of messages to them, and they sent out an email the next day saying that HUD is working on, with eSNAPs, the vendor, to be able to input the data with these standard changes already made. So they're working on their end to be able to let eSNAPs translate that data however it's going to work. They know it's an issue, which I don't know how they didn't know it was an issue. It's their grants. But they said that they're going to have that worked out. So, because that was my major concern, is how do we do an APR on programs that haven't even finished yet?
Right, and we have, if the update is going to happen by Bowman, we have projects that like you said, that even if they end at the end of September, then we have 90 days to submit.
Right.
Right. And then, so we're working on those now. Huh. Okay, well, this will be once again, an exciting year.
But HUD did say that they're working with eSNAPs to be able to take this information with the new APR, because all the vendors are pushing to get these reports out as quickly as possible. So they're working with eSNAPs to be able to make sure that that information can translate into eSNAPs.
Right. Okay. Good. Well, thanks for the heads up.
No problem. Does anybody else have any other questions? Okay, so Gilbert will be sending out data quality reports hopefully by the end of this week. We will make sure we point out in the email where you can find your list of entry and exit, so you can identify which people need to be updated in your reports that we send out to you. And then we will be making sure that this is a kind of a point of interest for us to look at when we're looking at these new data quality reports as they come out from Bowman. And we'll make sure that we make you aware and help you update any of them if you're having any trouble. But it's not going to be too bad this year. There's not that big of a change for most of these programs. They're just minor changes, except for like SSVF. That's a pretty big one. But
I have a quick question on the data reports that are sent out. The ones that you guys list are the ones that we have to go back in and add or make corrections to. We don't have to go back in over all of the clients, just the ones that you are listing? Or do you see what I'm saying? If we get a report for the family shelter and say there's 3 HMIS numbers on there, and it's the nulls, those are the only ones that we go back in and look at and change? Do you see what I'm saying?
What we're going to try to do with you guys is we're going to try to send those out on a weekly basis, so that way we catch everybody.
Yeah.
But if you ever, think that maybe that because of the sporadicness of the report or anything like that, you think we're not catching everybody, we can run those for longer time periods than just a week. Like we could run it for a whole month, or we could run it for a quarter or something like that to make sure that we catch everybody. Okay. The idea from what what we need to have happen is that anybody that's in your program as of 8/1 that was still in your program need to be updated, and then everybody that comes into your program going forward. So it would be everybody that stayed in your shelter overnight this weekend, and then everybody going forward would be the ones that we need to update. And for you guys, it's a pretty simple update because, like I said, it's just the living situation that we need to have updated for you guys.
It looks like the gender is coming up as well.
Oh, and the gender too. That would be correct if you had anybody that didn't identify as male, female.
Kyle, why would it? If I have everything answered, why would it still be red? Why would I still have that little red thing next to it? Like in the demographic, I have all the fields filled. So why would they still show up red?
That's a good question. We'd have to look at it. There's a lot of different things that can cause that.
Okay.
If you would like, could you send me an email with some of the clients that you're seeing those issues?
Okay.
And then we'll take a look at it, and we can make sure that we're looking at what's causing it. Maybe it's an error on the reporting end. Maybe it's something small like a date issue or something like that. But we can look at that if you just send me an email or a support ticket with those clients and what they're missing.
Okay.
Or just give me a call. That's fine too.
Okay. Thank you so much.
Yeah,
awesome.
Of course.
And what did you say about 8/1? Everybody from 8/1 until now needs to be go back. We need to go back in and answer. Now, if they're gone, we don't know the answers, then we're just going to have to leave them blank, and they're not going to be able to be counted.
Right. So if you have somebody that left your program, because 8/1 was days ago. That was Saturday. So if someone left, on Sunday or something like that, then yeah, you're just going to miss that data element.
10/1.
Oh, I'm sorry. Yeah. I thought it said 8/1 the whole time.
Okay. Well, you've interchanged, and that's why I was wondering if there was 2 dates we were to be looking at. Okay.
I apologize. Yes, it's October 1st. That's the defining date. I'm so sorry.
No, that's why you got me a little nervous there.
Yeah, we're just talking about 2 days here.
Okay. Perfect. Okay.
Thank you for that. But basically, October 1st is that date. If they were there that night, then those are the ones that you would want to update, and then everybody, of course, going forward.
Right. And if they've moved out already, they came in, spent a night, and they're gone, and we don't know, then it would just be data not collected.
That's correct.
Okay. All right. Okay. Thank you.
You're welcome.
Did you say you were going to be sending this, like this is a document that we're looking at on the screen?